At the posterior portion of the heart, right in this little crevice where the left atrium and right atrium meet, we have this little filled in portion. This is the coronary sinus. So another trick question, which I don't expect you guys to get either of these, by the way, but it's just kind of like stuff you might get more in lecture than in lab. Another trick question is list the vessels that empty into the right atrium. And right away you're like, oh, inferior vena cava and superior vena cava, right? But there's a third one, coronary sinus, that also dumps in separately. Okay, so that's right here. So remember, the heart has to eat too. It doesn't have any vessels that leave and then come back to the heart, and it just immediately feeds itself. Yes?
Which, is it the, you said atrium, or for that, or what?
What was the trick question?
Yeah.
It's the superior and inferior vena cava and the coronary sinus. Those are the three vessels that dump into the right atrium. Okay, next we have the fossa ovalis. I think, where's my view for that? Okay, so now we're going to take some of the, oh, I just realized that I forgot to talk about the auricles. Alright, so let me talk about the auricles for a second. That's jumping back up to the third ID. Totally forgot these guys. So the auricles, remember we had auricles when we were talking about bones and I told you they were the cauliflower ears? That's still true. Okay, so this guy right here, that's going to be the left auricle. It basically covers the anterior portion of the left ventricle. So here's our left ventricle. Underneath that, we know that it's ventricle, or excuse me, atrium. So it covers the left atrium. So we have the tan atrium right here, and all of this funky cluster of tissue that's very uneven. That's going to be our left auricle. The right one kind of just looks like this little flap here. So it's a lot less cauliflowery than the left ventricle, or the left auricle. So this would be the right auricle here. So just remember that the auricles cover the anterior surfaces of the atrium. Alright, did that. And then we'll go back to our other view for the fossa ovalis. Now the fossa ovalis you're going to find inside both the right and left atrium. Okay? It's going to be the same scar. It's going to be this circle right here. So if you guys have a heart that you can pull apart, look into the atrium and you'll be able to see it in both. And if you look like at both sides at the same time, you can see that it's actually the same scar. Okay, it's just going all the way through. This is actually a fetal scar that everyone has in their heart. That's why we get to talk about an anatomy, because it's actually a normal scar. When babies are still in the womb, they obviously don't use their lungs. That's why the lungs are the last thing to function or to form, because they get oxygen already in the blood from mom. But once they get blood, they still have to pump it throughout their system. So they still use their heart as a pump to get their circulation throughout their bodies, but there's really no need for it to go to their lungs because their lungs don't do anything. They're probably not formed yet because the heart forms way earlier than the lungs. So there's a hole here so that this can just conjointly act as a fill and a pump. So the fossa ovalis is a scar because in fetal humans, you just have basically one open atrium. And this is actually, it's not too uncommon for this not to close, because this will close around birth time, but sometimes it doesn't close for whatever reason. So there are some people that have mixing of oxygenated and deoxygenated blood still because their fossa ovalis didn't completely close all the way. And I think that that's actually one of the things that you can sometimes be diagnosed as if you have a heart murmur. So you can have heart murmurs for a handful of reasons, but that's one reason that you might have a heart murmur. Alright, so let's move on to the valves. We're almost all the way through, but let me stop and ask for questions real quick. Everyone's good? Alright, so we'll pick up with the valves. Now there are two different, actually I kind of like for valves this view a little bit better. So there are 4 valves. Each ventricle has 2 valves. There's one valve leading from the atrium to the ventricle, one valve leading from the ventricle to the vessel. And it's always going to be an artery, okay? So from the ventricle to the artery. Now, the 2 that lead from the ventricles to the artery, these are called semilunar valves. The other 2 that lead from the atrium to the ventricle are aptly named atrioventricular valves, okay? Just kind of a fun fact, and we'll see this on Wednesday when we look at sheep hearts. These semilunar valves, these little cusps here, they look like like shipping bubble packing. So you know, like the big pads of like bubble pop or bubble wrap. It looks like one of those. It's like half condensed. They're really cool looking, and that's essentially how it works. Is that they like are filled up with air. Well, I don't know if it's air, but they're filled up, and the entire heart works by pressure. So it has to pressure its way past the bubble wrapping in your heart in order to go into the other systems. These aren't as exciting, but they work in an exciting way. But we'll talk about this in a second. So with these semilunar valves, those are the bubble wrap ones. Their individual names are based on the artery that they're closest to or that they lead to. So in the right ventricle, the semilunar valve we have here is going to be the pulmonary valve because it's going to the pulmonary system, the pulmonary trunk. In the left ventricle, we have the just aortic. It's the aortic valve because it's leading to the aorta. Okay, so they're named based on where they're going to. Pretty simple. And just remember that these two are semilunars, that's the general name, and they have their specific names. It'll be important to know both because we could ask a question in which you would need to know it in either direction. Okay, which is which. Now for the atrioventricular, just remember that those are simply the ones from the atrium to the ventricle. And the models that we have, most of them you have like this little paper, white paper, and they're attached to the heart by strings. Okay? That's what we're looking for. Now their individual names are the tricuspid and the bicuspid. The best way that I've been taught to remember this is that you want to try it before you buy it. Okay? So just think of Costco, right? They have the samples. So you always want to try the samples at Costco before you spend $15 on whatever they're selling you. Okay? So you want to try it before you buy it. And like, same goes for here. Know that these are the atrioventricular. All right. Now we kind of have like almost individual parts of the atrioventricular valves that we're going to be discussing. So leading from the valve itself, which is actually this flap, there are strings. Those strings are called chordae tendineae. And you'll see that the chordae tendineae actually lead to a very, very specific muscle. It's a papilla looking thing. That's the papillary muscle. So the way that this basically works, when the heart relaxes, the papillary muscle attached to the chordae tendineae, attached to the valve, relaxes and pulls down, which opens up the valve so that more blood can enter into the ventricle. And then obviously when it contracts, you get a lot of you loosen the tension here, which allows the valve to close so the blood can only go out one way. That's kind of how that system works. It's almost like a pulley system. All right, then we have the trabecular carne, and the trabecular carne, if you actually look into the bodies of the ventricles, you'll see that there's almost like a lattice-like pattern in the heart. That lattice-like pattern is the trabecular carne, so it's all of that funky tissue inside the ventricles. All right, one more, and then we have the last three. So the last individual ID we have is the interventricular septum. So as the name kind of suggests, between the ventricles, interventricular, right? This is the interventricular septum, right here. Now the last three we have, the endo, myo, and epicardium, are the different layers of the heart. So if we're going to be asking you for those, just note that for those three specifically, we're going to be asking you to identify the layer, not the structure, just to kind of help guide the question a little bit. The innermost layer that we see is the endocardium. The middle layer that's made of muscle is the myocardium, right? Myo for muscle. And the outermost layer is the epicardium. Now for these two, the endocardium and the epicardium, because they are so thin and can be construed as other things. If we were to, for example, sticker the outside, you might say ventricle. Or sticker the inside, you could say trabecular carne. In order to make sure that doesn't happen, we'll be putting a sticker on the myocardium and pointing to the endocardium or pointing to the epicardium. So there'll be a sticker with an arrow to one of those two layers. If we're asking for the myocardium, there's just going to be a sticker on the myocardium with no arrows. Okay? And that's, again, just to help decrease confusion of that sticker being on multiple things. All right, so we're done with super long demo number 2. Any questions? All right, the next demo is going to be really short, so that's the good news. Let me give you guys about 15